The question today would be, does cycling actually increase your risk of having erectile dysfunction or weak erection? Let's find out.
I never bring out though.
I always wonder, with the nature of our sport, where we have to sit on the saddles for such many hours, and given how thin and hot our saddles are, does it not cause any short-term or long-term damage to men's private part? Unfortunately or fortunately, I don't possess the relevant organs. I literally have to ask around my male friends and also my followers on Instagram, and with the questions and their concerns.
So in this video, essentially, this lady is an avid cyclist. She cycles and she has a lot of colleagues who cycle along, and she would go on to ask a urologist this question, whether cycling increases the risk of having erectile dysfunction. And the explanation will actually border on, number one, the duration of cycling and the shape or nature of the saddle or the seat of the bicycle.
Since that I've collected, I am going to interview a urologist who happens to be an Iron Man to answer these questions.
Iron Man.
Welcome to the other episode of Terra Ask. In this series, I'll be interviewing different cyclists and asking questions that you want to know. So today, my guest is Dr. Bajo. Number one questions that I got is they are very concerned about the numbness in their private parts, predominantly on their testicles, sometimes it's penis, especially after either a long ride or a tough climb. It's either they couldn't feel it anymore, even when they're urinating, or they couldn't see it because it shrinks so much that they couldn't find it.
Okay, so this numbness has got to do with a nerve. Well,
I doubt that. Testicular atrophy. I seriously doubt that people's testicles will shrink completely to the point of not being able to feel or find the testicles. That's testicular atrophy. I mean, except if you're sitting on your saddle all day long, and I mean sitting directly squashing your testicles, I don't think that will happen. That's actually just an exaggeration.
Nerves that travel around the perineal area. The perineal area is the bottom area, or the pudendal nerve. All of us have sit bones. I can show you this part of the body. These structures are called ischial tuberosities, better known as sit bones. So when we are sitting on a normal chair like this, we are actually putting pressure on this part of the bone. If you imagine if you have a narrow saddle, the pressure is then transmitted more towards the center. And this is the area where all the nerves and blood vessels and muscles and urine tubes are traveling. So logically speaking, there will be some issues such as numbness. Having a wider saddle would help. I suppose having your sit bones sitting on the wider part of the saddle and having this cut out at the center, that can help ease the pressure at the center.
So essentially, from what this urologist has been saying, which he's been right. There's a perineum. So the perineum is that area between your balls or your testicles and your anal opening. So that area, at the bottom of your pelvis is called the perineum. And there are so many nerves: the pudendal nerve and the several perineal nerves, what we call the nervi erygentis, nerves that help with your erection, as well as lots of blood vessels that carry blood to the penis. So the shape of your saddle, having a wider saddle, having a saddle that is not very hard, so a well padded saddle, and then having that little opening right in the middle cut out to just ease that pressure on those nerves and blood vessels is actually something that would help reduce your risk of having erectile dysfunction from cycling. Essentially, let's carry
where all those nerves and blood vessels are running. There are other factors that are involved, like the duration of the cycle, the type of roads that you take, the type of bikes that you ride. People who ride triathlon bikes are sitting in a tuck position. They are the ones who tend to put a lot more pressure on their perineum. It's normal to have it. Some people do have it more than others. If you're not experiencing numbness, you're not been cycling enough, I suppose.
Obviously, yeah. So if you've not experienced numbness, then you've not cycled long enough. And that's actually true, because if you're cycling very long, then you're putting pressure on your perineum and you're gonna have problems, what we call neuropraxia. Okay, compression on your nerves will give you some numbness.
Now is how okay is okay. Does it lead towards long-term issue that men are concerned about? Would cycling cause them to have permanent erectile dysfunction, static issues such as inflamed prostate cancer, or cause them to have infertility. So are those concerns valid? The simple answer is actually all these concerns are not found to be true. I can say that it's a myth because as of now, I don't think anyone can prove that with absolute certainty that there is a direct correlation.
So
For infertility, I would say not really. I don't think cycling would necessarily lead to infertility directly. But for erectile dysfunction, yes, there's been a strong correlation between, compression on your nerves, your perineal nerves, or the nervi eregentis, and erectile dysfunction. In terms of infertility, except if that person is sitting directly on their testicles, which they wouldn't because that would be excruciatingly painful, I don't think infertility will only come in when obviously you're not able to copulate, you're not able to have intercourse because of the erectile dysfunction, but not because of low sperm count.
suspecting himself having erectile dysfunction, probably cycling shouldn't be the number one thing that they think that it's the culprit.
They should not. Male around the age of 40 to 70, the proportion who suffers from, say, erectile dysfunction can be as high as 50%, and it could be multifactorial due to other more common reasons, cardiovascular disease being one, due to disrupted blood supply to the penile structures. It could also be hormonal effect, testosterone.
I did a video with Dr. Mazwe on erectile dysfunction. I'll leave a link in the description so you can watch that video. Just as the urologist is saying, cardiovascular problems, hormonal imbalances, low testosterone level, psychogenic erectile dysfunction, especially young people. So if people are depressed, anxiety, having performance anxiety. So people, when they have new partners, they have that anxiety towards how well they're going to perform, and that alone can even reduce their performance and erection.
It could be due to other diseases that can affect the function of nerve and blood vessels, notably diabetes. So those things are much more common, strongly correlated with erectile dysfunction, as opposed to, say, cycling.
Cycling actually will help with that.
Yeah, cycling has been shown that it's a type of cardiovascular exercise that can help reduce the incidence and the risk of all these common non-communicable diseases. But I think you need professionals to assess you in order for you to ascertain whether is it the cycling or is it other things.
Interestingly, I have friends who told me that ever since they pick up cycling, they have better sexual performance, increased sexual desire as well.
I think it's got to do with gender.
Yeah, so the thing now is cycling is an aerobic exercise. So what it will definitely do in the long run is that it's going to increase your cardiovascular health. It's going to increase how well your heart is able to endure stress and strain. It's going to increase blood flow to all parts of your body. Your thighs, your legs, your abdomen. You're going to increase your overall health. But the thing now is, if your saddle, especially that saddle, the saddle of your bicycle, if it's not a proper saddle, if it's not well padded, the shape doesn't really match the size of your perineum. If you're a slim person, you need probably a slimmer saddle. If you're someone who has a wider perineum, you don't want a very narrow saddle that will dig right into your perineum. So you need to get the appropriate saddle that matches you, and it needs to have a lot of padding, so you don't have that direct effect or direct damage to the nerves and blood vessels that run through your perineum that supply health to your penis. So it's something that on a longer run, on a larger scale, cycling being an aerobic exercise is beneficial for your cardiovascular health, and then that will transcend into your sexual health improving. But then direct effects from the saddle can actually become counterproductive. So it's just something to bear in mind.
The feeling of being cardiovascular fit.
So would getting a bike fit solve this problem once and for all?
Yeah, all these risks can be mitigated. One way is getting a good bike fit. It's essential to ensure that you have good posture and you're not exposing yourself to not just numbness but injuries to your knees and your back, for instance. And choosing the right type of saddle, remembering that if you ease the pressure down there by riding out of the saddle, that would greatly help. There are ways to get around it.
Yeah, something else that is important is taking that occasional stand. So when you don't sit on your saddle all the way, throughout your journey. Sometimes you stand on the pedals and just allow the bicycle to keep moving. It just helps to take that pressure off your perineum.
Cyclists, we wear very tight cycling bib. Does it affect the sperm quality?
It does have an impact, but not to the extent that it will reduce your paternity rate.
Because you just need that one to make it happen?
Yeah, you don't need an army of sperm. And it's not something that is going to be a permanent, it's probably reversible. If you do have issues, take a cycling holiday for a while and your sperm quality should.
Cycling holiday.
So just to reassure patients who've been seeing us whenever from the cyclist community.
Is cycling associated with formation of kidney stones?
No, but being dehydrated, causing hypersaturated urine, can be a risk towards stone formation.
As a
Yeah, so cycling itself would not directly cause or increase your risk of having kidney stones. But obviously, if you're cycling excessively, cycling avidly without hydration, without, rehydrating yourself, then obviously you get severely dehydrated, and then that would increase your risk of having kidney stones. But not cycling will not directly increase your risk of having kidney stones. If you get severely dehydrated.
Urologist, who would you advise against cycling?
My advice would be if a person is having any form of urinary tract infection, they would probably want to abstain from cycling until they get better. Cycling for a prolonged period of time will make them visit the toilet less, and so they hold urine much longer, and they can just make things worse. There are some male who are diagnosed with prostatitis. They should abstain from cycling for the duration of the antibiotic therapy. It can be quite long, talking about possibly 2 to 6 weeks. Other than that, I can't think of.
Sometimes even longer. Chronic prostatitis treatment can actually last longer. Well, it's quite a tricky one because the infective chronic prostatitis usually, resolve with antibiotics quicker, but then the pain, the prolonged pain might actually, outlast the infection.
The benefits of cycling, of course, it far outweighs the risk. Today we are just only talking about the risk and how do we mitigate the risk, so all of us can enjoy cycling better.
So I found this video very helpful, and it makes sense to bring a professional. She interviewed a urologist who is a professional, so kudos to her for doing that. So essentially, cycling is overall beneficial to our cardiovascular health, which obviously will improve our sexual health. But pay attention to the saddle. Pay attention to how long you're cycling. You want to take cycling breaks, and you also want to take off that pressure from your perineum. The saddle shape, the saddle padding must be cut right to you for yourself, and also the height of your cycle, the handles, the height of the handles will also determine your posture when you're cycling, and that will determine whether you're putting too much pressure in, if the saddle is digging straight into your perineum, and that could damage your nerves and blood vessels and reduce the strength or duration of your erection. Thanks for watching.